Coronavirus. It's causing a lot of anxiety, and we can see why. A quick Google search produces headlines about exploding case numbers, closed borders, airport screens, and races to develop a vaccine. But how concerned should we really be? As usual, the answer lies somewhere in the middle. It's not nothing, but it's not the apocalypse either. This is Healthcare Triage News. Let's start with the basics. While the specific virus strain garnering major news coverage right now is novel to us, we've known about and dealt with coronaviruses for a long time. They're a family of common viruses that cause things from the common cold to severe acute respiratory syndrome, or SARS. Thus, even though many are referring to this current virus as coronavirus on social media, this one is actually just a new type of coronavirus, leading to its current and very creative name, 2019 novel coronavirus. It was detected in patients presenting with pneumonia in Wuhan City and first reported to the World Health Organization only on December 31st, 2019. While the virus has now been reported in the United States and proactive measures are being taken, the CDC reports that risk to the general American public is at this time low. There's a lot we don't know right now, and a lot of misinformation on social network sites. Some of these posts claim that the virus has left hundreds of thousands dead in China. It hasn't. That oregano oil can treat the virus. It can't. And that the virus is a form of population control by the government. It isn't. While my guess is that most people are not falling for these more outrageous claims, I'm also guessing that a lot of people are still anxious because the headlines seem pretty scary no matter where you turn. We get it. Viruses are scary. They hijacked host cells to copy themselves, wreak havoc, and then find more hosts. There's a reason they star in so many doomsday movies. But don't jump to worst-case scenarios. Scroll right past any headlines comparing this to the 1918 flu pandemic. Officials should and are closely monitoring the situation. In the meantime, the rest of us should remain calm. While we now know the genetic sequence of the new virus and are able to test for it, we have little concrete information on how it affects the human body. We know that symptoms include fever, cough, and shortness of breath, and that severity has ranged from little to no symptoms at all in an infected person to severe symptoms and even death. But keep in mind, much like we see with viruses like the flu, most of the deaths are in vulnerable populations like the elderly and/or those with underlying medical problems and weaker immune systems. And while the numbers look scary, it's important to remember that this early stage, we don't have enough information for those numbers to paint an accurate picture. As of January 27th, about 17% of confirmed cases were reported to be seriously ill and 3% of cases were reported to be fatal. Most reports of those percentages fail to acknowledge that the number of confirmed cases is likely only a fraction of all actual cases. Infected individuals with minor symptoms may not seek medical care and are thus not reflected in these numbers. If they were, these percentages would be smaller. Until we have that and other information to fill in the entire picture, we don't have a totally realistic view of the problem. Be alert, but don't panic. Although the situation is new and evolving each day, remember that based on current information, the flu is a far bigger health threat in the United States. Consider this, the flu virus has resulted in 8,200 deaths so far this season, a number that does not seem to be inducing fear in the public. We can't even get everyone to get the flu vaccine. For any virus, the basics always apply. Wash your hands often and for at least 20 seconds each time with soap and water. Cover your mouth when you cough and sneeze. Don't touch your face with unwashed hands, etc., etc. And of course, if you come down with symptoms like fever, cough, and difficulty breathing, seek medical treatment right away. Hey, did you enjoy this episode? You might enjoy this other episode on what is Zika? What should you do about it? It also helps if you like and subscribe down below. And of course, if you go to patreon.com/healthcaretriage, where you, like our research associate Joe Sevitz and our Surgeon Admiral Sam, can help make the show bigger and better.